is Caesar with Nursing School Made Easy. Today's lecture is going to be on hiatal hernia. Now, let's get right to it. One thing that you have to know is that a lot of the clinical manifestations, treatments, causes are the same as for GERD. So please review the lecture on GERD, and it'll give you a more in-depth look at some of the manifestations, complications, and so forth. So here we'll say that this is the esophagus. Okay, then we have the diaphragm. So this is the thoracic cavity, and then we're going to come here into the abdominal cavity. This is the stomach. Now, a hiatal hernia, the definition is herniation of part of the stomach into the esophagus. Now, the reason for this herniation is increase in abdominal pressure. That is the one thing that you must remember. It is all due to an increase in abdominal pressure. Now, women are more likely to have a hiatal hernia, and that's just, again, due to pregnancy. Pregnancy is going to increase abdominal pressure. So again, we just said that hiatal hernia is caused by increase in abdomen pressure, okay? Now, that is not the only cause. Other causes include obesity, exercise, any heavy lifting, some type of abdominal tumor. And we just talked about pregnancy. Okay, anything that causes an increase in abdominal pressure is going to increase the likelihood of that patient getting a hiatal hernia. Now, the increase in abdominal pressure is going to cause the stomach to push onto the diaphragm. And these muscles around the diaphragm, around the esophagus, they help to maintain the stomach below the thoracic cavity, in the abdominal cavity. But, for example, you exert a lot of force, a lot of pressure, you're eating large meals, heavy meals, and then you go to a from a sitting position or standing position to a lying position with a full stomach. What are you going to do? You're going to cause that stomach to press up against the diaphragm, against those muscles. Eventually, these muscles will get weak. And as that happens, what will end up happening is the stomach will protrude into the thoracic cavity, into the esophagus. Okay? Again, these muscles here will get weaker due to that pressure. And now you have the stomach in the thoracic cavity. So again, one cause for this would be weakness of those muscles around the esophagus and the diaphragm. Number one. Number two, increase in abdomen pressure. And we just talked about some reasons: obesity, abdominal tumor, pregnancy, heavy lifting. Exercises, that would be something like a lot of sit-ups, a lot of crunches, especially if you just ate and you go do that type of abdominal exercises, you're going to be increasing that abdominal pressure. Now, some clinical manifestations, these are again going to be similar to GERD. You're going to have heartburn. You're going to have dysphagia or difficulty swallowing. Now, the reason you have dysphagia or difficulty swallowing is because the stomach is again in the thoracic cavity, and so you're having to swallow, and you have this increased pressure. So you always feel like you have something stuck in your throat. Again, this is due to the pressure that's caused by the stomach being in the thoracic cavity. For other clinical manifestations, please review the lecture on GERD. Now, what are some complications? Number one, GERD. Number two, esophagitis. And again, this is inflammation of the esophagus, and that's going to be due to this increase in pressure. Now you have to remember that, like in GERD, this weakness or this weakening of this diaphragm is most likely also going to cause a weakening of the lower esophageal sphincter. If that occurs, then all the gastric contents along with acid can come up into the esophagus. Now that would end up causing GERD. Okay, now you have gastric contents, you have acidic contents in the esophagus. Those contents are going to cause inflammation of the esophagus. Now, again, if these acid contents continue to irritate the esophagus, you have the potential for some type of bleed. You also have the potential for ulceration. So ulceration can occur first, followed by bleeding. Now, we talked about how the stomach will actually come into the thoracic cavity and will be up here in the thoracic cavity again. Well, what's happening here? The diaphragm is still there. And this is just protruding. So what can actually happen is if this gets stuck up here, you can actually have strangulation. So that is number 5 on our list of complications. Number 6, again, we talked about this with GERD. Stomach contents are coming into the esophagus, so you're having some regurgitation. Now, along with that, you have the likelihood of suffering from aspiration. Now, what are some treatments? Again, a lot of the treatments are very similar to those with the GERD, so please review the lecture on GERD. Number 1, you want to tell your patient to decrease abdominal pressure. You can tell them to do this by losing some weight, avoid heavy lifting, avoid straining, eliminate constricting clothing, and that's a big. I've seen that on the NClex on practice questions many times. So you want to tell them to eliminate constricting clothing. So watch the belts. Maybe some older gentlemen or older patients may wear some type of girdle. So you'd want to tell them. You want to tell them to avoid tight clothing, tight garments. Okay. Number 3, you want to tell them to avoid alcohol, smoking. So again, avoid alcohol, avoid smoking. You also want to avoid your caffeine products, your chocolates. Again, all these things are going to irritate the stomach. You want to also tell them to elevate the head of the bed. If they're going to eat a large meal, you want to tell them to wait 2 to 3 hours before lying down. Medications include, so that would be number 5, proton pump inhibitors and your H2 receptor blockers. And of course, antacids.